Hey everybody, it's Dr. Eric Balcabbage. We're back for another edition of the Thyroid Answers podcast. And today I've got a special guest. I think I had this guest on my podcast maybe like early on, maybe year one. Now we're in year 6. So we've brought back Doni Wilson. She's a naturopathic physician and a stress expert. She's published a few books. I don't have any of them with me because I'm at my away from home office, and my book is on my shelf at home. So Doni, welcome to back to the Thyroid Answers podcast. How are you doing today? I'm
doing great. Thank you so much for having me back.
Well, I'm thrilled to have you back. We just kind of talked right before we got on. The last time I talked to you, obviously I said 10 years ago, but it was probably 6. Because our good friend Ben Lynch's conferences stopped, weren't kind of running in the same circles anymore. So we hadn't talked to each other in a while. So we just saw each other at a conference in Arizona, and we were like, oh, all right, we got to get back on the track here. And I needed to get you back on the podcast so we could talk about what's going on with stress. So to get started, how about we just reintroduce everybody to Doni Wilson? Who is Doni Wilson, and why should we listen to her?
Oh, thank you. Well, that's a good question. I ask myself sometimes. The thing is I, for some reason, wake up every day just asking questions related to how can we as humans be healthy, even though we're going to be exposed to stresses in our lives. I mean, yes, to some degree, we can avoid certain stresses and we can minimize exposure to toxins and we can do our best. But ultimately, there's going to be some stress exposure that we have no control over. And we know that it's these various stress exposures that end up affecting our health. They affect our gene expression. They affect our oxidative stress and our cellular functioning, which I know you love to talk about. Stress affects our hormones, our immune system, our digestion. And so it's that effect of stress that ends up causing the health issues that we experience. And so the way my mind works is I just think of it as, well, if I can reverse the effects of stress, that means I can reverse many health issues for patients. And that's what I've been doing for the past 22 years practicing, is just practicing for myself and for my patients to reverse the effects of stress.
Okay, so we have to talk about this a little bit, and I'm going to kind of set the table, and I'll ask you a bunch of easy questions, right? I think they'll all be pretty easy questions, but somebody's going to sit back and say, listen, I know 2 people, they undergo the same stress. One loses it and has problems. The other person under the same stressors seems to be fine. So is it really the stress?
What I would say is, and I like to emphasize, that we each have a different response to stress. It's very unique. We know that we're different individuals. We're different genetically. We're different in terms of our stress exposure in our lifetime. We're different in terms of the stress exposure of our parents and our grandparents. And that changes the way we experience and the way our internal body and hormones and neurotransmitters respond to stress in any moment. So 2 people could be in the same, let's say, tragic event or crisis, and those 2 people could have very different responses to it. Now, there's also the part that comes into play where we'll hear people talking about like mindset, right? And that we, to some degree, have a choice of how we respond to a stress in the moment. And this is true to some extent. Like we could, in a moment of stress, are we going to, freak out, or are we going to be problem solving? And I think to some degree that could be partly personality, and it could be partly what is that person doing on a daily basis to create calm so that they're ready to respond proactively when a stress comes along. So there's the difference in how we respond in the moment. But what I'm especially looking at is, how is our cortisol responding? How is our adrenaline responding? And how quickly does it come back to optimal?
So there's the questions that I was hoping that you kind of get to those pieces. And one of those is, and how I explain it to my patients is, stress is not a bad thing, right? And we have to talk about stress, right? So maybe I'll let you start there, right? Everybody, when we talk about stress, everybody thinks that we're talking about emotional type experiences, right?
Yeah.
Is that what you're referring to, or are you talking about something more complex when you say a stress?
I mean, I'm really thinking of all the possibilities. So it could be something psycho-emotional, like let's say a death of a loved one, or an argument with a loved one, or a deadline, right? Or because even sometimes I see students, children who are under stress because they're stress just related to their expectations at school. So we experience stress, psychological stress at all ages, but we can also experience stress on a physical level, whether that's an injury or even just exercise we do on purpose. We're essentially stressing our muscles on purpose in order to create muscle growth. And so there is this, what's referred to as eustress, EUSTRESS, which is just stresses that we're gonna have as humans. In fact, if we didn't have any stress, we wouldn't be existing. Like, we know this from the research. Humans actually require some amount of a stress and a stress response that's just normal. So the goal is never to have zero stress. There's also stress, by the way, in the form of infections are a stress, I would consider. Toxins are a stress. The goal is not to have zero stress. There's a lot of different types of stress, and a lot of it that it's normal. We want to even choose to be a parent, right? We're going to have children on purpose. And there's stress that's involved, but that's okay. We, as humans, we also have a built-in stress recovery system. I think we just don't take enough advantage of our stress recovery system.
Yeah, and that's where I was hoping you would get to. So for the listeners, when we're talking about stress, it could be, I'll just kind of summarize a little bit. And in my book, I talk about the fitness factors. And so we talk about physical fitness and emotional fitness and habitual fitness and dietary fitness and microbial fitness, right? We talk about all these different things. And with those is all the stressors in those categories, right?
Yes, that's a good way to say it.
Sleep distress, right?
Yes.
So all of those systems, physical, chemical, emotional, microbial, respiratory, sleep, habits, all have the ability to create a certain amount of stress in our life. And what Dr. Doni was saying is that some stress on the physiology can be good, right? It helps strengthen us. That's why we lift weights. I want to go into the gym. I want to break my muscle down, stress it. And then if I allow for time to recovery, I reduce the stress and now I can rebuild and recover, right? That's what sleep is all about. I stress all day and then I recover, rebuild, and I should, if I have good sleep and recovery and I have all the tools in place and I'm breathing well, then I should be able to recover, right? And so that's my rest and recover phase. We don't do that very well, so that adds to the load. But some stress is important because we have to challenge the system. And so that's all. The stress can be considered eustress or distress based on whether we perceive it as good or bad, right? And I got a little problem with those because something that's bad can still be considered a eustress too. But too little stress, we don't grow, we don't develop, we don't get stronger. Too much stress without recovery puts us into danger physiology and shifts our physiology. So the issue is, if the only people who have no stress in their life are dead, as far as I know.
Yeah.
And so the plan shouldn't be to not experience stress, but be able to adapt better, faster, quicker, recover better, faster, quicker. So that's really what we're talking about. And it can be from multiple different sources. So I know we want to talk about adrenaline and cortisol and the effect of those things, but I want to touch on one other point before we get there, and that is the difference in how people respond. I think depends, my opinion, and then you can jump in here, depends not so much on the stressor, but the current state of that person's physiology. Mm-hmm. And I like to explain to my patients, let's say there's a baseline of really low stress and I'm in a full recovered mode, right? If that's 0 and max stress before I go into danger mode is 10, if I'm walking around at 0, right, or 1, let's say, to be fair, and I get a significant stress response, let's say at a grade of 5, that pushes me to a 6, but I'm still in adaptable mode. And as long as I get recovery, I may go back to baseline. But if my accumulated stress load is keeping me at about an 8 or a 9, and I get that same stimulation of a 5, right? That's going to push me into danger physiology. And so my explanation to patients is two people in the same and get the same stressor respond differently because of their current state many times. And so for the people that are pretty healthy, don't have a lot of issues, they're probably operating at a really low level, right? They're recovering each day, so their base stress level is low. But the people that we see that have chronic health issues and small amounts of stress seem to push them into problems. They're probably hovering around that 8, 9 on a regular basis. They're in and out of crisis mode all the time. Would you agree with that, or do you think not so much?
I definitely think that's part of it. And I talk about, I do a lot of, and we can talk more about this too, like how can we create a life where we can maintain that level of, stress and stress recovery in a, sort of countering each other and staying in balance. I talk about using self-care, like a self-care routine, and I use the acronym CARE to stand for C for clean eating, A for adequate sleep, which you talked about, R for recovery activities, of which there's many that research shows helps us recover from stress, and then E for exercise. And of course, doing all of these things in such a way that doesn't, again, overstress you, but actually helps you with your day-to-day maintenance and recovery from stress, so that you have this foundation of balance. And from there, whatever stress comes by, you're ready to respond and recover, and you can come back to your baseline. And I definitely think that makes a difference.
And I want to dig into that a little bit later. So I want to get into some of this other stuff first. But so we talk about where somebody is, because do you think that somebody responds differently based on that state? And I talk about are we in a state of homeostasis versus state of allostasis? So you're familiar with those terms, I'm sure. So do you feel comfortable kind of explaining to the listeners, what's the difference between homeostasis and allostasis? And then we can get into the different response that somebody might experience if they're in a homeostatic response versus an allostatic response.
Well, and it's some of what we've been talking about already. The homeostasis is where, we can experience stress, but then we're coming back to an optimal state. It's not that we ever expect ourselves as humans to be a machine or a robot. Like, it's not that we're not going to have some response to stress. We want to have a healthy stress response, and then we want a healthy recovery. And homeostasis is that the balance, the keeping things in balance, and our bodies have a built-in system and ability to maintain balance. And allostatic is just when it goes outside of that range, where it's that distress. I use that term too. Like, when does something become a distress where now it's causing problems, it's becoming an issue, and can cause more inflammation or damage to our cells and our functioning. I also like to bring in this other term to this conversation, which is hormesis, because hormesis is when we can kind of push the limit a little bit. We can purposely put ourselves under a little bit more stress, as long as it's, as you mentioned, creating growth, creating positive change, stimulating a positive effect in the body, and we can use hormesis that way. But if we overdo it, then now becomes a problem, and it's now becoming a negative outcome. The problem is that there's not, like, as humans, we're so used to going more, doing harder, going extra, that we're way more likely to overdo it and find ourselves in that danger zone, even if we're trying to do something that's good for us, right? Like, sometimes you're exercising, but then you over exercise and you end up, having to go through a recovery just from over exercising, for example. So I always say there's such a thing as too much of a good thing. And it's hard for us to learn how to dial that in. And it's also unique for each person. How do you find, and it can depend on your stress exposure at the moment. So if you're under a lot of stress, your ability to do more, you may only have a little bit of room to work with. But if we get this homeostatic level at a good place, then you have a little more room to work with. in terms of, expanding your activities without overdoing it.
Yeah. And I think I'm going to maybe add a little comment
Give
to
your
that
Eric version for sure.
Well, no, but for the listeners, from when we think about the difference, like homeostasis, I've got all the energy I need to do to adapt to that stress response. So I get a stress response, my body's like, cool, I got enough reserves here to deal with this, and then I can bring us back to normal.
Yeah.
If you think about allostasis and an allostatic response, this requires me to move resources around. I don't have enough resources to deal with the new stress plus my normal everyday stuff. So something has to be reduced in an effort to deal with the new stress. And so I need to turn metabolism down to, let's say, my GI tract, because I have to deal with this infection. I need to turn down my energy production because I got to deal with something else, right? So when we're in allostasis, it's often a trade-off response. I don't have enough resources to do everything I need to do. So I guess the best example I would give, if I had a whole bunch of family members come over to my house on a whim and I'm in homeostasis, I go downstairs, I got extra food in the refrigerator, I bring it up, we're all good, it's no big deal. If I have a whole bunch of people come over and I'm maybe in a more allostatic, an allostatic response would be like, I don't have any more food. And so instead of everybody being nourished to their maximum, right? I'm going, you get one little serving of here, you get one little serving, you get one little serving, because I'm trying to feed the masses, but I may not really be supporting everybody. Or the opposite thing may happen. I may say, look, you 4 people that came over, I don't even like you. I'm not feeding you. I'm only going to feed these people that I like. You guys get nothing. That would be more of an allostatic response. So it's always a trade-off situation. Now, in an acute situation of stress, oftentimes we can manage it, right? We're in homeostatic response. We have that acute stress response. We go, hey, I got it. But in that allostatic stress response, we don't adapt well. That's where we really start to have some issues. So let's talk about a stress response. And people talk about cortisol, and we've got some other stuff called epinephrine. But can you give the listeners like a little bit of an explanation of what happens in an acute situation? Let's just say homeostatic regulation, acute situation. What's happening in the body?
Well, first, we often hear about the fight or flight response, right? And, this is where oftentimes I say, like, the alarm goes off, right? And you immediately just feel your blood pumping, your mind racing, you're ready to respond. That's this very immediate fight or flight response with adrenaline. And this is what adrenaline does. It helps us respond to stress. It's a good thing. It's going to help you get out of danger. And that's the initial part of a stress response. Then what quickly follows up is what we refer to as the HPA axis. So the amygdala, which is in the brain, that's picking up on a danger, a stress, it's going to tell the hypothalamus to tell the pituitary gland to tell the adrenal glands, which are down here above your kidneys. And the adrenal glands make both cortisol and more adrenaline. And so they're going to push cortisol and adrenaline, more of it, out into the bloodstream to help us respond to stress. It's going to, as you're alluding to, it's going to be saying, okay, we're not going to digest food right now. We're not going to be thinking about reproduction. So we'll turn off the reproductive organs, and we're going to just focus on raising our blood sugar levels so that we can respond to this stress. So it turns down hormone functioning like thyroid and all the other hormones in the body. Even insulin function decreases, which raises the cortisol of the glucose. And so we get this ability to respond to stress in the moment, which we need if there really is a stress going on. And then what should happen is, as the brain picks up on raising cortisol levels, it turns that off. That's the feedback, is the cortisol goes up and the hypothalamus goes, okay, we have enough cortisol, we can stop this signal to the adrenal glands. That would be the healthy response. And so then the levels come back to optimal. We don't go down to 0 cortisol and 0 adrenaline. We actually need an optimal amount of cortisol and adrenaline throughout the day and all the time. So it's just bringing it back down to optimal. And that would be the healthy response. The problem is that we're constantly re-triggering our HPA axis. with our stressful lives. And so then the feedback loop stops working.
Yeah. So for the listeners, because this is the Thyroid Answers podcast, and Dr. Doni said that, hey, when we have this acute stress response, it has an effect on thyroid physiology. And so I want to explain that maybe a little bit more so that we understand what's going on there. Your TSH levels will go down because when we have a stress response, what happens is your hypothalamus, which is another beautiful gland in the brain, right? It gets the signals that, hey, there's some type of stress response, and T4 to T3 conversion increases in your hypothalamus. So there's an enzyme called deiodinase 2, which increases in a stress state. And there's another enzyme called deiodinase 3, which gets downregulated in the hypothalamus in a stress state. What's the benefit? By doing that, increasing T4 to T3 conversion in the hypothalamus, that triggers and continues to activate that sympathetic nervous system, that fight or flight response. And so what does that do? As Doni said, hey, that's going to stimulate that sympathetic nervous system. Sympathetic nervous system is then going to impact going to go to those fat glands. You're going to start sweating. You're going to start perspiring. You're going to start start releasing fatty acids. You're going to increase glucose production because your body's like, whoa, what's going on here? We got to do some stuff. The downside is when you decrease that when you saturate the hypothalamus, you get a drop in TRH, and therefore there's less TSH from the pituitary gland to stimulate the thyroid gland to make more hormones. So the actual production of thyroid hormone goes down, and in the periphery, we also get a downregulation. We get a decrease in deiodinase 2 in a lot of the tissues, as we were talking about, the ones that aren't as important for that danger response, and we get an upregulation of deiodinase 3, which is the deactivating enzyme. So our body's saying, hey, there's danger, tissues and systems that are less important. Let's slow the whole thing down so we have more energy to drive the other aspects. So that's what's happening. So in the brain, you're actually getting an increased conversion of thyroid hormone, but in the periphery, you're getting a decreased activation of thyroid hormone. And so in an acute state, that's great. But what happens in the chronic state?
Yeah, and that's the thing. We end up in our lives like one stress after the next. And so I say we get stuck in stress mode, like literally the light switch is stuck on. And so we're just constantly triggering the adrenal glands, and the adrenal glands are trying to keep up with making enough cortisol and adrenaline. And these systems that work well in for an acute response, it doesn't work so well long term. Because if we're inhibiting our digestion long term, now we're not digesting our food well, we're not absorbing our nutrients, we're disrupting our gut bacteria, we're creating a lot of inflammation there that affects everything else. Our immune system isn't working well. We know that we become more susceptible to infections and allergies and autoimmunity and cancer when we're under chronic stress. Also, like you're saying, now we've down-regulated thyroid functioning throughout our bodies, and if that happens over time, now that creates all kinds of different symptoms, let alone the other hormones that are under functioning, and the neurotransmitters, serotonin, GABA, these also tend to get depleted. So it's like all the systems that have been turned off, as you explained, and kind of down-regulated by stress, it just creates these chronic health issues. And I think that's why we're seeing so many people who are experiencing symptoms related to high inflammation. Even anxiety and depression are tied to inflammation in the nervous system, let alone inflammation in the blood vessels that leads to various, heart attacks and strokes, and inflammation in the brain that leads to dementia, or chronically high blood sugar levels leading to diabetes and dementia, or you know what I mean? Like I could just go on and on like this. When this is a chronic state, that's when the health issues that we're dealing with develop.
Yeah. And so we're going to talk about two things, but I think the first one to discuss is, many times I talk to my patients about the impact of stress on their physiology. And what people will say is, I really don't have a problem with stress. I just have a thyroid problem. I have a gut problem, but I don't have a problem with stress, right? So why do you think it is that people who clearly when we look at their labs, we listen to them, we listen to their conversation, we look at their health history and their timeline, we go, this person's in an excessive stress response. But why do you think people don't perceive that they are?
It's such a good question. I've been asking myself that too, because so often patients will say to me, I don't feel stressed. And I think to some degree it's a definition issue, right? Like we have a perception of what does a person who's stressed look like or feel like, right? So a person, I think a lot of people think that a stressed person feels maybe really frazzled and anxious. And some people don't feel frazzled and anxious, but they still have the effects of stress going on inside their bodies. So I think sometimes we have to stop and say, well, what's your definition of feeling stressed? And it's a lot of times you might not perceive it because you also might not be, you're so used to it, right? Like I think we get so used to being stressed, it becomes so familiar that we're like, oh, well, this is just the way it is. We lose track that's actually what we're experiencing.
Right. And I think that's the biggest factor. I was hoping you would go there, that we don't know what we don't know. Right. And so if this is how everything is, then we perceive it to be normal, right? I think this is how I'm supposed to be. I've been like this way for my whole life. Well, that doesn't mean it's been right for your whole life. Right. Mm-hmm. Right. You mean it'd be like somebody saying, well, I think I'm rich. Well, because you've lived in poverty and you have $2 more than everybody else in poverty, right? So you think you're wealthier, but that's not maybe the case, right? So I think as we get more compromised and we get used to it, we're just like, okay, this is the way it's supposed to be. And if you watch TV, you might be convinced that that's all normal because, man, every drug commercial is telling you it's not your fault. This is just the way it is. This is a disease, right? That's a disease. This is a disease. So you go, oh, I'm pretty functional. It's just diseases happen. That's just the way it is. But I think it really comes down to two things. One is we become used to what we experience and we consider it normal. I guess three things. Two, we don't know what we don't know. We don't know what better feels like until we actually experience it, right? Then you go, oh, what was that? What was that? What was that moment that, right? And I explain that to people all the time. Like I think I'm, like people say they're healthy. Okay, I'm fit. Okay. So could you run a marathon? Well, no, I couldn't do that. Okay. So then are you as fit as the person that can? Well, I guess not. Okay, right. Could you hike a mountain? No, I couldn't do that. Okay. Could you lift 300 pounds? No, I couldn't do that. Okay. So you're fit for what you're doing, right? But there might be a whole nother level that you just don't experience, right? Yeah. And so every day, I mean, I think I'm fit, but could I be fitter? Absolutely. But I'm pretty comfortable where I am. But if I worked out hard and it got to another level, I'd be like, wow, what was I thinking before? Right. So, and I think another problem is that we don't really have a good definition of what health or healthy is. Right. When you ask health expert what healthy is, they go, I don't know. I mean, they many times I've had a couple people on here and I've asked them point blank. People who say, hey, I'm a longevity expert, health and longevity expert. Okay. Expert. Okay. Tell me what's the definition of health? And they don't want to answer the question. They don't want to get into it, right? Because they don't have a great definition other than it's a state of physical, chemical, and emotional well-being. Okay. So then tell me the definition of well-being. Well, that's where they feel healthy. Well, you can't use the same definition to explain itself, right? So tell me what it is, right? So that's a problem. So everybody assumes they're healthy, regardless of how many medications they're on. My doctor says I'm healthy. I feel healthy. Aren't you taking a blood pressure medication, a statin, a thyroid medication, and a PPI? Yeah. But you're healthy? Yeah, my doctor says I am. Right?
It's such a good point. I love this, Eric. I love how you dive into these topics and you're just like, wait a minute, let's really be willing to question ourselves and the way we're thinking about this, because I always say I grew up in a pharmacy. My father was a pharmacist his whole life. And in my childhood, that was all that was normal to me, was going into the pharmacy. And my house, all the cabinets were filled with samples from pharmaceutical companies. And yet, here's the thing my dad would always say is when I would hear him talking at the dinner table, it would be, eat this food because it's going to keep you healthier so that you are less likely to need a medication. You're going to be preventing health, osteoporosis, whatever we name, like eat this food so that you can prevent this health issue. That's what I heard all the time. And when I got sick as a kid, my parents didn't give me a pharmaceutical or an antibiotic. They just basically said, here's a blanket and some hot tea and rest, And so even though I grew up in a pharmacy, basically, that's not the way that my parents handled my health. And so it really, to me, was not surprising that when I graduated with my pre-med degree, that I decided I don't want to go learn how to just use pharmaceuticals and surgery. I want to learn how to use diet and nutrients and herbs in order to prevent health issues. And I think because of the way I was raised, I think about things in this totally different paradigm than sometimes, someone who maybe wasn't raised in that same way of thinking.
Yeah, I think for a lot of people, they grew up when you have a fever, if you've got a snotty nose, right, that your body is sick, versus my body is responding with these things like the fever, the pus, the snot, the mucus, the fatigue. That is the body's adaptive response to find what it is and kill it. And unfortunately, I think a lot of people grew up in a model like, oh, as soon as you get a fever, you got to get rid of it. As soon as you have a tummy ache, you have to calm it, right? As soon as you have a symptom, you need to get rid of it because the symptom is the bad thing. The symptom is the body's signal to us that, hey, I'm in process of trying to deal with something. And I kind of grew up in a similar model. It was funny. My grandmother used to, what was her solution to everything was a little hot toddy and a blanket, right? And so you're going to sleep, right?
Yeah.
You're going to go to sleep, you're going to sweat it out, right? If you've got too high a fever, she would put you in a cooler tub and just try and cool the body down, but not suppress anything. And, as a kid, we didn't know any better. But, when I tell that story to people, they're like, well, they were torturing you. Why wouldn't they just give you like Advil or Tylenol or something to suppress the fever? I'm like, I think the fever was probably supposed to be a good thing. And now we know that, right?
Yeah, but you would think, me growing up with a pharmacist father, that he would have been giving me, Tylenol and so on. We had it right there in the cabinet. But no, that's not how it was treated. It was treated with, let's help your body through its process, and start to trust the body's ability to heal, and how do we support it through the healing process instead of suppressing it or finding something to kind of be a band-aid or a crutch in the situation. And so I think sometimes that is, and just anyone listening, I would say, kind of look back on your childhood. What were the messages around your health and healing from your childhood that you might then be kind of carrying forward with you? And a lot of times when I talk to new patients, they have come to a point in their life where they realize, wow, first of all, a lot of patients will say, I'm very sensitive to medications. And myself, I'm so sensitive to medications and other substances too. So patients will say, I'm so sensitive to medications. I can't take more medications because they make me feel worse a lot of times. Other patients are like, listen, my doctors already have me on 5 different medications. I don't want to add more medications to my list. I want to really solve the issue, not just add more pills to the list. Because then those medications have side effects and they interact with each other and they're not really getting anywhere, right? And so people start to realize, wait a minute, is this way of thinking actually helping me? Because these are patients who are maybe in their 50s or 60s of years old, and they're like, I've got some decades left in my life. I don't really want to add 5 more pills for every decade of my life. I want to actually be out there enjoying myself and preventing health issues so that I can do that. And I think that's more the definition of health, right? Is how can we be in a state where we can live what we're passionate about, doing what we love with the people we enjoy to do it with, and feel good doing it, have that ability to really thrive and live our purpose for as long as we can. Because really ultimately the only thing we can count on is that at some point it's going to end. Our life is going to come to an end, and we don't know when that's going to be.
Yeah. And yeah, it's all about a level of adaptability, our ability to thrive and survive in our environment. And that our environment dictates to a large degree what that means, right? So somebody who's in a more aggressive environment has to have a whole level of a better level of adaptability. And somebody who's in a less aggressive environment, they may not need to do as much work to be able to adapt. They may not need as much rest and recovery because they're not putting as much stress on the system. So I think it is individualized. So I want to jump back into this discussion though, chronic stress, right? And there's this term that you hear quite a bit called adrenal fatigue. So I have my opinions about adrenal fatigue, but tell me what your thoughts are, because it gets talked about a lot. People say, well, I've got adrenal fatigue now. We talk about acute stress and we get a cortisol rise. Can you explain what people might be thinking when they talk about adrenal fatigue, typically low cortisol? Does adrenal fatigue exist from your experience, or is something else going on?
Well, and I think part of me is grateful that the term was put out there and people became familiar with it, because it at least brings people's attention to the adrenal glands, because otherwise we're never talking about the adrenal glands. And when you go to the conventional doctor's appointment and do a physical exam, or you do standard blood work, it's not going to come up in the conversation. And so the adrenal glands would be forgotten if not for this term adrenal fatigue. So I'm glad in that way that it exists. I just think that it's not an adequate term. I think we can get way more accurate and way more specific. So I always warn people, if you've heard about adrenal fatigue, that's just the tip of the iceberg. Now we need to go, what exactly is happening with your adrenal glands? Is your cortisol too low? Which the term adrenal fatigue kind of assumes that a person has low cortisol, low adrenaline production. But I think a lot of times people use the term adrenal fatigue and they're thinking that they don't even know what the cortisol is, right? It doesn't necessarily mean that out there. So I always say to people, if you think there's something with your adrenal glands, okay, that's the beginning. Now let's find out, is your cortisol too high at certain times a day? Is your cortisol too low at certain times a day? What about your adrenaline? Is it too high or too low? Like, let's find out exactly the state of your adrenal glands, and then we can help them, because the treatment's different, right? Depending on what's happening with your adrenal glands, it's a completely different treatment.
So do you see that people with more chronic stress response have a tendency to have lower cortisol production?
Not necessarily. I did a retrospective study in my practice on this, because I'm constantly measuring patients' cortisol and adrenaline levels. And so I did a retrospective study of 127 adults, and we looked at that. These are people under chronic stress. Does it mean that the longer you're under chronic stress, that your cortisol gradually goes down? I mean, that would also probably mean that the older we get, the more likely we have low cortisol. And what that study showed is that it's not the case. Someone under chronic stress could have high cortisol, or someone who's younger, could have low cortisol, even though they haven't been under chronic stress for 30 years, right? So it's not about time or age. It's more about the individual person's body and whether their cortisol is going to go too low at what point in time.
Yep. So I agree. And I'll give you some perception, and I'll put this out there for the listeners. From a chemistry perspective, from a physiology perspective, when we're in a homeostatic state, or when we're in a more chronic stress state, we have to ask the question, I guess we started with the question, how do I make cortisol to begin with? Mm-hmm. Right? So in a homeostatic state, let's start there. Mm-hmm. How do we make cortisol? And so what we do is we bring cholesterol from the bloodstream. There's these things called lipoproteins that you have circulating in your blood, right? They dock to receptors on your adrenal gland, and we pull the cholesterol into the adrenal gland, and then we bring it into something called your mitochondria, And that cholesterol is converted into something called pregnenolone in the mitochondria. And then that pregnenolone can go on to make, depending on what area of the adrenal gland it's in, it could make cortisol, it could make DHEA, it could make other hormones, right? So we have this precursor thing that's made in the mitochondria. Now, why is that important? Well, one of the things that importance in how it relates to your thyroid physiology is, guess what helps regulate the transport of cholesterol into the body? It's called T3. So when you have an optimal state of T3 at your adrenal gland, those lipoprotein receptors work a little bit better. What helps regulate the mitochondrial conversion of cholesterol into pregnenolone, one of the big factors that regulates your mitochondria, is something called T3. So when we are in acute stress situations, the body needs fast production. So the adrenal glands in an acute situation have the ability to make their own cholesterol in acute situations. So we can, in a moment's notice, we can do it. We can't do that for an extended period of time, but we can do it in a quick, acute state. The adrenal glands can make the cholesterol, convert it into pregnenolone, and then make our cortisol. So now we can get high production of cortisol. But in homeostasis, we need it. We get that from the bloodstream. In chronic stress situations, guess where else we get it? We get it from the bloodstream. Because the acute phase in the adrenal gland, it's like, okay, I did what I could, and now we got to bring the stuff back in. But what we talked about with stress response is that when we're in that, when we have chronic stress, we get upregulation at the hypothalamus and we get downregulation in the periphery. So what happens if that decreased T3 state is affecting the adrenal gland? We have the decreased ability to bring cholesterol out of the bloodstream into the adrenal gland, so cholesterol production could go down, okay? Now, what else might we see? Well, if you're that person who's got elevated cholesterol on your blood panel, right? And we see this all the time as we look at blood panels, is somebody's got a hypothyroid state, their cholesterol and LDL are up, and guess what goes down is HDL. Well, now at one point we thought that the LDL was transporting the cholesterol into the adrenal gland. Now we believe it's HDL might have the bigger transport mechanism. So if I've got this chronic stress state, I've got a chronic downregulation of T3, we often see on that lipid panel that HDL levels are low. So now I have less available resources to even transport that cholesterol out of the bloodstream. So based on my literature review and digging in, I think that's a bigger thing that's happening. Not that the adrenal gland is fatigued, it's exhausted, but it doesn't have the ability to make it anymore. We're really good in the acute state, but I think we're not as efficient in that chronic state. Now, if I have chronic stress, but I have adaptability, I've got appropriate T3 levels, I can be in chronic stress and make cortisol all day, right? So that's how I see the difference. You want to throw some insight into that?
No, I think that's really interesting, that connection with the T3. And it sometimes then, I think for some people, that's really like probably a really prominent situation. And I think you can see how it's like we're stressed, and then it makes things come to a standstill, and then the more things are at a standstill, the more stressed you are. It's like the that Chinese toy, the finger toy, where if you try to pull it off, it just gets tighter. And I think that's why sometimes people feel like I'm doing everything I can, but I can't get this to turn around or break this pattern. And this is why, because it's like it. As much as we would hope that things would be easier to turn around, if it gets too far down this road, it's hard. It gets harder to get it to stop. And I think that's why for you and I as practitioners, we know it requires a more complex way of thinking and a way of being strategic with your health plan. Because if you're only just trying small things, it's not going to work. It's just the cycle is going to keep going, and you're going to keep feeling worse, and it's going to be frustrating.
I love the fact that you said that that was a toy. I think in reality that was a torture device, but I love your spin on it. Yeah, I think it was a torture device.
Oh my gosh, I just always remember we had, like, I'm thinking of Halloween, they would give these things out, but yeah, it sounds like a torture device. I never liked those things.
So we know that stress can have an effect. We just talked about the acute phase of stress. We talk about, I think we should talk about the adrenal physiology a little bit, right? Because when we have more chronic stress and we're depleting that cortisol production, maybe we're not generating as much, we're really struggling, especially if we've got down regulation of thyroid physiology, we can maintain our ability to function, right? And it's a different hormone neurotransmitter. You talked about a little bit about adrenaline, and another word, epinephrine, right? So what happens with adrenaline in that chronic stress response, and what's the impact?
Well, and here's what I was going to say too about cortisol is that I think that what I see in my research and in my practice is that some people, for some reason, can maintain high production of cortisol for longer periods of time. And that's why I always feel like it's so important to test, because if we just guess, then we're totally missing it and we're not going to have the right treatment. So we really need to look at, like, okay, and I think there's a lot of things that goes into that, is including with adrenaline. Some people, their adrenaline goes high and just stays high. Other people, their adrenaline goes down. And I think it's a combination of things. It's to some degree genetics. Like, we know, for example, that the COMT enzyme metabolizes what I refer to as adrenaline, which is norepinephrine and epinephrine. And so if a person has a genetic variation where their COMT either goes faster or slower, that's been known to affect whether they are more likely to have a high cortisol, right? If the COMT goes slower, they're having higher adrenaline levels. If COMT goes faster, they can become depleted in adrenaline levels faster. So that's part of it, but I don't think it's only the genetics. I know that our health is also determined by our prior stress exposure, and our epigenetics, how our genes are expressing themselves, and so many other factors. These enzymes are also affected by toxin levels and inflammation levels, and right. So it's like all the things that can affect the ability for our body to metabolize adrenaline come into play and determine whether a person's going to tend to have higher adrenaline or lower adrenaline.
Yeah, I think that's a key point. And I think for the listeners, it's important to understand she's talking about an enzyme that helps do a lot of the detoxification pathways, the COMT enzyme. Now, many of us have polymorphisms of this. And so when we talk about the gene, it can be what we call the wild type, which is kind of a medium processor of estrogens and epinephrine and a bunch of these things that need to go down this tunnel or through this detoxification pathway. Some people have polymorphisms that cause them to process the neurotransmitters much faster. Some people have a genetic makeup of that COMT enzyme that makes them process it much slower. Not that one's good or bad, right? They could be. The difference is, and this is how I try to explain it to people, is in my family, we have all three versions, okay? I'm more middle of the range, right? So I don't get too high, I don't get too low, right? We've got one child who's a really fast metabolizer. And so nothing seems to bug him. Nothing seems to really get him overly motivated, right? So this is the same person who would wait. If the paper is due at 12 midnight on Sunday, he starts it about 11:45, right? Because now all that stress and tension to get it done really gets his brain focused and motivated, right? And we have somebody else in our family who is probably got the polymorphism that is a slower metabolizer. So when they're healthy, they are very driven, very organized, very particular. They're the person you give everything to do because they'll get it all done, right? They're very motivated. The problem is when you add the same amount of stress potentially to the person who's the fast metabolizer, that may get them motivated. But that same load of stress to the slow metabolizer might push them into anxiousness or anxiety. Would you agree with that?
Yep. They call it worrier. I think there's the worrier and the warrior, right? And it is like so that you can think, okay. And I would say it's just for people to know your own body. Like this is why I would want to measure a person's adrenaline level. So then you just know how your body responds, so that you can support. You can choose stress, and you can choose your stress support in a way that matches your physiology.
Yeah. And so let's talk about this a little bit, about the assessing stress response, right? So somebody's sitting back, they're going, I don't think I'm stressed. How do I know if I'm stressed? Does the individual determine whether they might have excessive stress response that's creating some of their health issues? That's part A. And then part B, we'll talk about how as clinicians, we might help somebody evaluate them, whether it's blood or saliva or urine, to assess a stress response. So first, let's talk about from a person's perspective, how do they assess them? What can they use as tools to assess whether they're in an excessive stress state?
I've been working on questionnaires related to this for a couple decades, and this is part of what I did in the research that I did in my practice. As I was looking at how much can we rely on symptoms to help inform us of whether a person has high cortisol or low cortisol, for example. From that study, which is I think kind of interesting, especially related to this term adrenal fatigue, as what I saw is that the people who we couldn't use fatigue by itself to determine, because sometimes people with high cortisol also experience fatigue. But what I did see from that study was that people who have more extreme fatigue are more likely to have low cortisol. But this is all just more likely. You still are, the only way you really know is if you measure it. Now I developed based on all of that, I developed a questionnaire that's in my new book, the Master Your Stress, Reset Your Health book, and it's available on my website too. I called it the Stress Type Quiz. To me, your stress type is based on your cortisol and adrenaline levels. And so this quiz is going through a number of questions to help us understand better 5 key areas. This is what I found is, to me, it comes down to these 5 key areas of your well-being. So I encourage, if you're wondering like, okay, am I affected by stress? Is my stress outweighing my anti-stress? I would look at these 5 areas. One is your energy level, like your energy level during the day. Think of, do I have enough energy? How do I feel when I wake up? How's my energy level? How do I feel through the day? Do I run out of energy at a certain point? So we're looking at patterns of your energy level. We'll also want to look at your focus. How well do you feel like you can focus on a task and complete a task, or are you feeling like a brain fog and kind of forgetfulness? We also look at your sleep. How well are you sleeping through the night or not? Is it hard to fall asleep? Are you waking up? All aspects of sleep. We'll also look at your let's see, we got energy, focus, sleep, mood. How's your mood? Are you feeling anxious, depressed, having symptoms related to mood, irritability, so on? And the 5th area is what I call your body, which is, are you feeling pain, heart palpitations, weight gain, water retention? How do you feel in your body? And based on those symptom areas, that helps me determine, if you have symptoms in all 5 areas, then we definitely know your stress is outweighing your anti-stress. If you maybe have some mild to moderate symptoms, then, it's more, maybe you're doing a better job of your recovery than someone who's in a severe state. But then from there, I can start to assess whether you're likely to have high cortisol or low cortisol, and high adrenaline or low adrenaline. But again, ultimately the best, most accurate way is to actually test those levels in your body.
Okay. And so are there tools that somebody could look at besides the quizzes on their own to say, I'm struggling with not recovering from stress?
Well, definitely you can, we can look at things like just how you feel in your body. Sometimes, like as practitioners, we'll look at, there's a classic for adrenal functioning of looking at like postural blood pressure levels. So if what's your blood pressure when you're laying down versus when you stand up, and how well can your body move your blood basically when you change postures. We can look at pupil dilation. There can be a delay in pupil dilation and with adrenal issues, but these to me are really non-specific. It's you start to go, well, how severe is it, and is the cortisol high or low? We can't, it's not very reliable. I don't know if those are the things you were thinking of, but there's things that we can sort of look at, but it only kind of gets us in the ballpark. It doesn't tell us exactly where we are.
Yeah, I would add a couple things. Like there's tools out there called HRV, heart rate variability. So
Yeah.
if you're a person who has an Apple Watch, and people can argue whether the technology is the best or not, I don't really care if that's what you have. If you find that you have a lower HRV, that's probably an indication that you're not recovering very well. You could look at your just average heart rate, right? What's my average heart rate? If you're probably on a regular basis, your resting heart rate's below 60, you're probably doing a little bit better. If you're over 60 in the 70s and 80s, you're probably not doing quite so good, right? You could look at your respiratory rate. If your respiratory rate is, this is going to sound crazy, but if your respiratory rate's probably above a 10 or a 12, you're probably not doing as well than if your respiratory rate is below that. Optimal respiratory rate, we'd say the average respiratory rate in the US is somewhere between 18 and 25, but optimal is around 6 breaths per minute. Okay, so if you're doing a lot of short, shallow breaths, that's a sign of poor health. And so those would be some kind of easy things, I think, if you had the tools that you could take a look at. But let's talk about something like sleep. How would a stress response, being in excessive stress, impact sleep? Because somebody might say, well, if I have excessive stress, shouldn't I just crash and sleep really well? Why am I having disrupted sleep?
Yeah, really, it depends on how their cortisol and adrenaline's responding. But I mean, some people do. They're like, no matter what, I land in the bed and I'm asleep immediately, no matter what's going on. But for some people, especially I would say if their cortisol goes high or their adrenaline is high, and if their GABA and serotonin are low, which is the calming neurotransmitters, they're more likely to have a hard time falling asleep or waking up in the middle of the night and not being able to get back to sleep, or waking up too early in the morning. This is all, to me, signs that the cortisol and adrenaline are out of range during your sleeping time, and that's disrupting your sleep.
So some people would say, okay, well, I take melatonin because it's supposed to help me sleep, and it helped initially, but now it doesn't help. What is melatonin? What's its role and what's it supposed to do? Why does it help some people? Why do you think it doesn't help others?
That's a great question. It's true. I mean, melatonin is, I think, it's our sleep hormone, right? So it is meant to tell us to sleep. It's just that, I would say sometimes people are like, oh, I'm struggling with sleep, let me take some melatonin. Yeah, sometimes the issue is mild enough that just some melatonin is going to solve it. But if a person has imbalanced cortisol and adrenaline, then melatonin may or may not help, because there's other issues that are not getting addressed, and they might override whatever dose of melatonin that you're taking. And melatonin often does get depleted when we're under stress. Melatonin is made from serotonin, and if serotonin is depleted, which it often is from stress, then we're low on serotonin, we're low on melatonin, and that could be part of the problem. And of course, if we're having a lot of light exposure at night, that turns off our melatonin production. So that's another contributing factor to low melatonin. But I do like to point out that insomnia is not always just due to low melatonin. There's a lot of other things that can be involved.
Yeah, absolutely. And for the listeners, I'll give you this insight into melatonin. Melatonin, it kind of rises as the day goes, and it's kind of opposite of our cortisol level, right? Yeah. So those two things are opposite. So if cortisol is up, melatonin is going to be low. If melatonin's up, cortisol is going to typically be low. But melatonin is not what keeps us asleep. Melatonin tells the brain when it's time to start shutting down. And so as it rises, it tells the brain, okay, it's time to start turning stuff off and get ready for bed, right? And then it should decrease as the night goes on.
Mm-hmm.
And as it starts to get lower, then it starts to tell the brain, hey, it's time to start waking. Okay. Now, but it's not what keeps us asleep necessarily. There's another molecule called adenosine, which is really our sleep hormone. Mm-hmm. And so adenosine is the thing that really helps us be deep into that kind of slumber mode. That's like one of our true sleep hormones. So that when we really exercise and work hard, and we're outside doing yard work all day in the cold, we sleep like a rock. Why? Because we've used up so much energy and we've produced so much adenosine, and that helps us take that really deep, really restful, recovered sleep. What we're doing all night is taking that adenosine molecule and loading it up with these things called phosphate molecules and regenerating this stuff called ATP. So adenosine probably has a bigger factor. When you're drinking your cup of coffee, right, to try and keep awake, what are you really doing? You're not really playing such a role against melatonin. What you're doing is you're blocking what we call the adenosine receptors, so that those adenosine receptors don't work, and so you're less likely to get into a deeper sleep. You can still fall asleep, but you probably won't get into a deep recovered sleep. So adenosine is probably the more important molecule to worry about, and probably one of the reasons why Dr. Doni talks to her clients about fitness and exercise, because that is an important focus. So the other thing that can happen, and Doni was talking about cortisol and adrenaline. During the night, we need to make energy, right? And so maybe, Doni, you can talk to people why when you're healthy, you can go through the night, you're not eating, but blood sugar stays pretty stable. And maybe why when you're in a more stressed state, why blood sugar regulation, especially as it relates to your cortisol and your epinephrine, may be one of the reasons why you continue to wake at night. Can you talk a little bit about that?
Yeah, definitely. And not only just the waking at night, but during the day, people will get, when there's a imbalance of cortisol and adrenaline, a lot of people, that's one of their predominant symptoms is feeling like their blood sugar keeps dropping. And then if they do consume carbs, then their blood sugar goes way up high. It's this blood sugar roller coaster, essentially, where, you eat some carbs and your blood sugar goes too high because the insulin functions lower. And then before you know it, it's dropping way down. And I went through this myself for many years. I was on such a blood sugar roller coaster. I was like, how do I get off of this roller coaster? It was terrible. And it can disrupt people's sleep, because if your blood sugar goes up and then you go to sleep, but then as soon as your blood sugar drops, it wakes you up again. And the way you're managing your blood sugar during the day can also affect how you're sleeping at night. And I love that you're pointing this out, because I think for a lot of people, this is the thing. And then what happens is people will tend to wake up in the night and feel like they need to go eat something. So now we're eating in the middle of the night, and in some ways it might be a quick fix, but it ends up perpetuating the issue. So now we're just keep on this perpetual feeling like you have to constantly be eating in order to manage your blood sugar. But really it's a deeper issue. It's that this stress response needs attention.
Yeah, I think a big thing that happens at night when people are sleeping is if they have this kind of stress response going on, typically we all have about 4 hormones that are going to raise our blood glucose. It's that important to have glucose going on. We only have one that drops it down, right, directly, and that's insulin, right? Yeah. And so at night, if we don't have the available glucose, our body says, okay, we got glucagon, let's get some cortisol start to rise, because we're going to need a little bit more. Like, we can use some cortisol to help make it, not too much, but just a little bit between the glucagon, a little growth hormone, and cortisol, we can do it. But if that's not working really well, and the tissues are like, hey, we need some glucose, and they need glucose because they're trying to do repair, and repair requires a lot of energy, you do have that one hormone that will definitely raise your blood sugar, and that's your adrenaline that Dr. Doni was talking about. And if you're using adrenaline to generate glucose at 2 or 3 o'clock in the morning, guess what? Not only is it going to generate glucose, it's going to wake you up.
You're going to be anxious and be like, your mind's racing and you're like, what's going on?
Yeah. And one of the things that I've seen by doing some challenges with patients is that when we slap a CGM on them, mm-hmm. and they think that their blood sugar is low and they need to eat something, I always tell them, look at your CGM first. And what they often see is my blood sugar is high, right? What's going on is your body, by the time you're getting those cues, your nervous system has already kicked in to start loading glucose into the system. So the reason your glucose goes sky high after you eat is because your stress hormones have already kicked in more glucose production. You're adding more glucose from a food production, and now you're driving it sky high. Now you got to raise your insulin levels. And the other thing I think that happens at night for a lot of our clients who are in chronic stress is they have chronic inflammation. And chronic inflammation narrows the nasal passageways and causes us to wind up opening our mouth at night to breathe. That creates a state of what we call hypoxia, and that creates stress response,
stress.
Right? Mm-hmm. And then you're going to the same situation's going to start to occur, right?
Yeah.
So let's talk about the books, right? You've got how many books out now? And then we're going to talk about the most recent book.
There's 5 total, and I, for the most part, I'm writing about what we've been talking about today, stress and how it looks and how to help us, to recover from it so that we can be healthier even though we have stress in our lives. And then, the most recent one is the Master Your Stress, Reset Your Health.
So is the most recent one, because somebody might say, well, I want to go get one or more of Dr. Doni's books. Is each one like I learned this, I wrote a book, and then I learned more and I wrote another book? Or is it each book is different? We're talking about a different topic.
That's a great question. I would say that it has been a progress. Like the first book was published in 2013. So it was based on, and it includes the research I was mentioning today, the research of the 127 patients, and looking at what can we take from this research and understanding the effects of stress on our body, like we've been talking about today. And then the next one really, one of them is just about what I call stress remedies, these stress recovery activities. And then there's one that's called the Stress Warrior, which is going into more specific some of the epigenetics and these genetic variations. And then this most recent one, what I did is I wanted to not only review the stress response as we're talking about today and help people understand that, but to really help them understand what I refer to as the stress type. So it has this quiz that I developed over all these years to help people to get a sense of, do I have high or low cortisol, high or low adrenaline? And what I do is I take things to the next level. So beyond just saying that we should all be doing self-care, right? And exercise and recovery activities and getting enough sleep and eating healthy to help our bodies recover from stress. What I do in this book is I review the research and say, based on my stress type, based on whether I have high cortisol, low cortisol, high adrenaline, low adrenaline, how should I as an individual be implementing my care, my recovery activities, and also which supplements should I be using to get my cortisol and adrenaline back to optimal? So this recent book is the most strategic in terms of a protocol to recover based on your personalized, your individualized stress response.
Okay. So we're going to talk about your care method in a sec, but let's talk about somebody says, okay, I need to test it. You're telling me I need to test those levels. If they're going to a practitioner, and you don't have to talk about company names, but you can if you want, I don't care. But what are they testing? Are they testing blood? Are they testing urine? Are they testing saliva? What are they testing? Because right now, there's some different opinions as to what's valid and what's not valid. There's a whole community that talks about blood testing only is the best marker. There's some people saying in the functional medicine space that all the urine and saliva testing is not maybe valid. There's other people that swear by urine and saliva testing. So what's your thought process on? We'll talk about cortisol first, and then we'll get into adrenaline.
We can measure cortisol in the blood. It's just that, then we're usually only getting cortisol at the time your blood is drawn. And we know that cortisol changes through the day. So really, we want to get the most information as we can. If we want to know what is your cortisol, for example, when you wake up in the morning, what is your cortisol in the middle of the day, in the evening, and at bedtime, or if you're waking up in the night, what's your cortisol? Is it high in the middle of the night? And so that'd be a bit much to try to get your blood drawn at all those times a day. Plus, for some people, just getting to the lab to get your blood drawn is stressful. So that could affect your cortisol levels in the moment. So yes, you can measure cortisol in the blood, but for what I'm doing with my work, I want to measure cortisol throughout the day. So I'm usually using either saliva or urine levels. And from my experience, I find them to be accurate, or at least give me enough information. At least I can see what's the pattern. Is this person trending toward having high or low, or at certain times a day? And so I do find that, and I use both urine or salivary levels of cortisol at different times a day.
Okay, so for the listeners, there's different companies that do urine tests, saliva tests, urine and saliva tests. And then there's blood that you can get in a regular blood lab. I think my opinion is, I think if I'm sending somebody to get hormone testing, other hormones done, I'll do a morning cortisol because they're already there. I want to kind of see what it is. But I totally agree. Just the effort of going to the lab could cause somebody to have a stress response, right? And we have this thing called a cortisol awakening response in the morning, which may cause a rise too. But to me, our job is not to just read a lab, it's to interpret a lab. So having the blood cortisol, I think, is a good strategy if you can get it and if it makes sense, right? Then looking at urine, saliva, and if we have the blood, if we have the urine and we have the saliva, then we look at the patient's signs and symptoms and say, okay, how does this stuff correlate? Because many times we look at that graph and we say, this probably means this person's perceiving a bunch, they may be crashing, and they go, no, I feel fantastic. That's when I have most of my energy. Sometimes it really correlates. Sometimes it doesn't necessarily correlate like how we might think it might look, but that's what our job is to listen, look at our patient's signs and symptoms and see does the graph correspond with what my patient's saying. Do you find that as well?
Absolutely. Yeah, absolutely. And I would say that there's some labs that I don't tend to use because I don't find that the way they report it is clear enough even for me. So I tend to use labs where the reporting makes it really clear. And so if someone has had this test done and they're like, here's my results from one of these other labs, and I'm like, it's just not even clear enough to me from that, the way they report it. So, I mean, if a practitioner is listening, then I would say, make sure you're using a lab that's giving you really clear reporting so you can clearly see what the cortisol is up to.
Yeah. And I think it's important for the listener, because if you've seen a test, maybe like the Dutch test, and you've seen you're thinking, wow, I'm exhausted and fatigued at 3:00 in the afternoon, but my free cortisol is really high. What the heck is going on? That doesn't seem to fit. It can fit, but that's our job. You can't just necessarily look at that and say, oh, the lab is wrong, or this doesn't correlate. We have to look at all the other factors, right? It's about interpretation, not just reading for high or low.
And the thing is that fatigue can happen with high cortisol too. So it's not just the symptoms. Yeah, it's we have to put it together. Absolutely.
So, and we probably should touch on that, right? Why would high adrenaline or high cortisol potentially cause somebody to be fatigued?
Oh my gosh, I'd love your ideas on that, Eric. It's I think it's because it's not just only about giving energy levels. It can affect, it could be affecting their thyroid function. It could be affecting their other hormone levels. It could be, and I think sometimes too, I look at it as just if they're under sort of a constant stress with constant high cortisol, then they're not even getting the benefit of energy from it anymore because their body's just getting exhausted underneath.
Yeah, I try to explain it like you got the gas pedal to the ground, right? And so it's wired and tired. So when you're in this stress state and you're ramping up these stress hormones, what did we talk about right in the beginning is you are increasing T4 to T3 conversion at the hypothalamus. You're down regulating thyroid physiology in the periphery, which means you're down regulating your cell metabolism. So now instead of taking glucose and making energy efficiently, typically when you have a healthy situation, you take one glucose molecule and you make these 36 energy molecules. And that's a really good return on your investment. But in a stress state, we're not using that mitochondria to generate energy as efficiently. And so we get more of a net loss of energy. So we're almost in a deficit when we're in chronic stress, and we've got to steal that energy from other systems. So that creates more chronic fatigue. We deplete those ATP molecules more quickly. So I think what happens for a lot of people is they're still burning, they're still having to make energy, but they're having net negative when it's at the end of the day. And so there it's like, whoa, I am crashing, because they just can't refill those resources as quick. So I think that's probably that's what I see as the main factor there. So we've got, we talked about testing. Let's talk about epinephrine or adrenaline. How do we assess that?
Well, it can be measured in urine. So we can measure, dopamine, norepinephrine, epinephrine in urine levels. And again, there are a couple different labs that offer this. And I tend to just use the lab that the reporting is the clearest for me and my patients, so I can really see what's going on. We can also measure the metabolism, the breakdown of norepinephrine and epinephrine in like organic acid panels. So sometimes it's helpful to see both, to see what's the norepinephrine and epinephrine and what's the the breakdown products of those. And so then we can really start to see. But if we only have organic acids, then that still leaves us hanging a little bit. I prefer to actually see norepinephrine and epinephrine levels as well as dopamine. And then by that point, I might as well also, because in the same urine sample, we can measure serotonin and GABA. And this is what I found for myself, by the way. I mean, and I completely burned out my adrenal glands multiple times in my life, but particularly after I finished my training as a naturopathic doctor and a midwife, where I was staying up all night delivering babies for several years. And then I went on to have my daughter. So I was still up all night, but with my daughter and working. And I finally tested my levels and I was like, oh my gosh, I was really low on both cortisol and adrenaline, but that's my stress pattern. And so, but I went right back to what I learned in naturopathic medical school is, okay, let's support the adrenal glands, support the adrenaline production. And I actually felt worse. And what I figured out at that point is that ultimately I had to first support my GABA and serotonin levels and do some other things, to help my body heal, help my mitochondria, for example. Because if we just go and we realize, oh, I have low cortisol and adrenaline, I'm going to go push on the gas pedal and try to get my adrenal glands to make more cortisol and adrenaline, they can't do it, or you're going to feel worse because your body's not even ready for that. You have to, so I talk about this in the Master Your Stress book. We have to first help build up our calming part of our nervous system, the serotonin and GABA, and help our mitochondria and help our body drop our inflammation levels. Then we can support the cortisol and adrenaline. So if we get the cart before the horse, it's not going to help either.
Yeah, I think sometimes what we do, even as functional medicine practitioners, we're trying to fix something that's not really broken, right? Mm-hmm. What we're seeing is the adaptation, and we're trying to fix the adaptation when that's not really what needs to be fixed. We need to identify what those stressors are and remove them. But let's talk about the testing, because I know a lot of people I've had a lot of people come to me, they've got their organic acids, whether it's on a hormone panel or whether it's organic acids or whatever. And I think sometimes they're misinterpreting what they see on there.
A lot of times, yeah.
And so somebody will say, well, obviously I'm not having, it doesn't look like I have a stress response, because the two markers that we typically look at on the specific to epinephrine and dopamine and catecholamines is HVA versus VMA. Mm-hmm. So they'll look at those and say, hey, those values are low, so therefore I need to add support, right?
Yeah. But that's only one of the possibilities. It could also be it's not being metabolized well.
Yeah. So can you explain that a little bit?
Well, it's somewhat back to these COMT, enzymes, but it's like if the if there's I think of it like a dam, if with a dam you're holding back the water. So then if you're only testing what comes through, you see a low level coming through, but that doesn't necessarily mean that there's a low level in the system. It could mean that it's just being held. And so it could actually be high, which is why, again, I would say we got to measure the actual level, because otherwise we might be thinking it's low, giving something that increases it, and then the person feels worse.
Yeah. So for the listeners, there's a marker called HVA. That's the direct metabolite of dopamine. Dopamine can also go down another pathway to make your norepinephrine and epinephrine, which is what we kind of consider the fight or flight hormone. And if you see that they're both low, we then need to consider exactly what Doni's saying. Is it because are they both low because I'm not making much? Or are they both low because I'm not metabolizing them, right? I got a problem, I can't get rid of them. And so you can test the values. The other thing we can do is we can ask you questions like, are you a person that's low tone, super low tone, super kind of low mood, right? Or are you a person who's more edgy, more anxious, more irritable? Well, I'm more anxious, more edgy, more irritable. Okay. Well, then you're probably not metabolizing them very well, right? The other pattern we sometimes see on there is we see a higher HVA. So the dopamine pathway seems to be working pretty well, but the epinephrine pathway is not working well. And we have to then again ask the same question. We would say if the HVA pathway looks pretty good, we'd say, well, probably making a lot, right? But still, we want to ask you, do your signs and symptoms fit the super chill, laid back person, or the symptoms fit the high, more edgy, more anxious, more fired up person? And more times than not, the person will be like, no, I'm edgy and anxious. Did you see my intake form? I'm edgy, I'm anxious, blah, 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 right? That's the person who's having problems in the pathway. Yeah. And so normal might be normal, low might be abnormal. And sometimes if we see both of those pathways that are elevated, we might say, oh my gosh, I'm under so much stress. I might look at this, and Doni she's going to answer this in a second. I may look at that and say, based on the stress you're under, yes, you're making more stress hormone, but this is an appropriate response to somebody who's under acute stress. So I don't think we really need to do anything to manipulate this. What we need to do is say, what's the stressor? Can we reduce it or eliminate it? Do you interpret those the same way?
Yeah. It's basically like you just have a high amount, but it's flowing. Mm-hmm. We want the flow happening. So if it's flowing, then it's like, okay, at least nothing's getting jammed up in a traffic jam. But we want to just go, okay, how do we lower that flow? How do we bring it into more of an optimal range? Because even if it's flowing, if it's at a too high level, it still can be causing damage.
Right. So let's get into the C.A.R.E method, because we've got a little bit of time left, but I want to talk about what's the C.A.R.E strategy for helping somebody. Let's dig into that a little bit. You mentioned it a little bit before, but let's break it down a little bit with the time we have left.
Well, and the thing is, like, I kept talking about these things all the time anyway. We're always talking about, like, how do we choose foods that are going to help our health and not be a stress to our health? So this is the C is this concept of clean eating, which is avoiding things like even sugar or pesticides or, processed foods, things that are going to be more of a stress or a toxin to our body and our food, and choose foods that are healthier for us, right? So it can be as simple as that. We can also dial it in even more specifically for each individual. How do we, are there specific foods that are inflammatory for your body? And we can dial that in even more, depending on the person's situation. Sometimes we need to, but that's this concept of, how do we use food to help us to counteract our stress exposure and not add more stress. A, for adequate sleep, we talked about, how do we not only just get ourselves into the bed when our melatonin's rising and make sure we can try to get at least that 7.5 to 9 hours of sleep, but if there is a sleep issue going on, let's solve it. Let's figure out what's really going on so we can help you get better sleep. So you can get that recovery time in. And then R for recovery activities, which again, there's so much research on different potential recovery activities, everything from even quiet and solitude to music and spending time with other humans and pets, as well as spending time in nature and, so many more. I even include in this category recovery substances, because sometimes we're using, for example, let's say plant substances. Even we could talk about cannabinoids or psychedelic medicine, or substances that we have seen now that help us, even like helping with our telomeres, for example. Like, how can we use substances that help us with stress recovery? And then E for exercise. How do you determine the right amount, the right intensity, the right duration, the right time of day to exercise for your body to be responding and recovering to stress versus depleting yourself more?
Yeah. And I think what we have to make sure that we get across to our clients and to the listeners is that it's unique to the individual, right? Mm-hmm. Everybody's response is going to be a little bit different. If we take 5 people and throw them in the CrossFit gym, right? That may be excessive stress for half of them, right?
Yeah.
You could say, well, isn't lifting good? Yes, lifting weights is good. But for some people, that is more stress than their current state of physiology can handle, right? Yeah. I have this conversation with my clients who are, everybody typically wants to lose weight. So what do? They start running, right? And I'm like, okay, running can be great, but here's the problem. You're probably running in what we call the black hole zone. You're running at a pace that's not going to allow you to burn fat, which means you need to generate glucose. And if you're running for 40 minutes or you're doing a HIIT class for an hour, you're not be able to burn fat if you're going too hard for too long. So what is your body going to do? It's going to rely on glucose. How are you going to get it? You're going to increase your cortisol. You're going to increase your epinephrine. And that is the cycle that we're talking about, excessive. So day in, day out, you are doing exercise in a threshold that's not conducive to a lower stress physiology, and you're jacking your cortisol and your epinephrine to just do the activity. Yes, exercise is healthy, but the way you're performing it may be inappropriate and unhealthy for you, right? So I think it's important, because sometimes people hear, well, the stress is causing my high cortisol, so therefore I'm not going to exercise anymore, right? Exercise is causing stress. Well, no, exercise should cause some stress, but if we do it right, it's hormetic. If we do it wrong, it creates a problem, right?
Mm-hmm. Yep.
So,
and I think a lot of it is us learning. What's hard for us as humans is that a lot of times doing less is better. Like, especially if you are finding yourself in a really stressed state, and it's out of balance. There's more stress than there is recovery, and your heart rate variability is showing it. Your cortisol and adrenaline levels are showing it. And then you're like, oh, what, we almost are like so stressed, we want to do more. But actually what we have to learn is, how do I do less? How do I do more of what my body needs to recover, but in a way that is much less than we're used to? And it's a hard lesson. I think it's a hard lesson for us to do less, and that less can actually be better.
Yeah. I mean, just think about like a HIIT cycle, right? So somebody with the typical mentality is like, if HIIT is good, right, high intensity interval training, well, then an hour should be awesome, right? What they don't realize, that you'd probably better 20 minutes and less for that HIIT workout. You're going to do what your body needs to do. You're going to support it without blasting it into an excessive stress state, right? And so HIIT is good if it's done appropriately. If it's done inappropriately, not so good. And I typically use an example for people who like are bike riders. I like to ride, so I think I can talk on this. It's terrible for overall cortisol level for most people, okay? Because when I know where I live, there's no flat. It's all hill, right? So when I go for a ride, you're automatically above heart rate most of the time. So you're into that black hole zone. So now what happens to the average run-of-the-mill everyday kind of weekend bike rider who's going out with their buddies is they're riding at a heart rate that's more intense than it should be. They're in that black hole zone. They're relying on cortisol. They're burning lots of glucose. They're not burning fat. So they have this body where they're even though they're doing all this exercise, they got their muffin top, right?
Mm-hmm.
And they're craving carbohydrates. So what are they doing halfway through the bike ride? They're stopping for their oatmeal, right? We ride here, everybody's hungry. We eat our oatmeal, then we crush it on the way back. And yeah, I exercise. That was a 3-hour ride, right? But it was not good for your health. What? Yeah.
It's not even worth it. It's not even worth it.
And so those are the things, and that's what people throw their hands up and go, well, then I'm not exercising at all. You have to do physical activity and exercise on a regular basis, but you just need to do it smarter, right?
Yeah.
So here's what I want to do, Doni. I want to leave with 3 quick hitters. What are 3 primary things that somebody could do today, tonight, tomorrow, to start supporting better stress recovery on a daily basis? And then I want you to tell everybody where they can hear more about Dr. Doni.
Oh, thank you. I think one thing I would do is just start building in some even small breaks into your day. Now that could be 30 seconds, that could be 1 minute or 5 minutes, but just this practice of saying, okay, I'm gonna set down my computer and my phone and all the tasks in front of me for a couple minutes, and I'm just gonna, even if you just do nothing. I mean, the thing is, like, how do we be okay and practice with just doing nothing? Or maybe you want to just take a couple deep breaths, because when we take a couple deep breaths, we're signaling to our parasympathetic nervous system, which is the opposite of the sympathetic nervous system. And we can purposely trigger the parasympathetic nervous system by doing a few different things, but one is taking deep breaths. So if you just go, okay, let me practice taking a deep breath and see how that feels. And you can do that when you're taking even these little small breaks in your day, whether that's every hour or at least every 4 hours, take a break.
I love that one. I call that the 20-minute rule. So set your timer on your phone, because I know you have one right next to you, right? And every 20 minutes, get up, move, do some squats, do some lunges, do some push-ups, take a couple 30 seconds to do some deep breathing. You'd be surprised, sneaky, how much work you can get done in 30-second breaks. And sometimes my clients will say, well, I'm on the phone every 20, I was on the phone. Great. Reset your timer and catch the next 20 minutes. Yeah. So if by the end of the day, if you even got 10 micro breaks, there's going to be a benefit. And I had one of my clients, I said, every 20 minutes, set your timer. I want you to get up and do 5 push-ups or 5 squats or 5 lunges or whatever, because they said they had no time for workout. By the next time we talked on the phone, they were like, I'm getting like 100 push-ups a day or 100 squats a day. I'm feeling the difference just doing that. I'm like, right. In 30 seconds, right? That you could have looked at your Instagram, you did those things, right? So I love that one. So take micro breaks, 20-minute rule, 30-minute rule, whatever you call it, but set that timer. What's number 2?
Let's see. Number 2, I would say, is to check in with yourself. Check it. Like we talked about today, these different symptom areas. So your energy level, your focus, your sleep, your mood, and how you feel in your body. And I encourage people to do kind of a self-check every day. How do you feel? What signals is your body giving you? Because when we're under constant stress, we lose track of what messages is my body actually giving me. And another follow-up from just noticing what signals is your body giving you is to journal about it. You can, either get an actual journal, which I created one I call the self-care notebook. But you can also journal on whatever other way you have in front of you and write it down so you can start to track, like, what did I do yesterday and how do I feel today? And then what am I going to do differently today so that I can see how I feel tomorrow? So you can start to build some history on this, and you can, I would say, be gentle and forgiving of yourself. This might be my number 3. I don't know how many I'm at now, Eric, but like, just accept that you're living in a human body and you're not going to get it perfect. The point is not about getting it perfect. The point is, how can we learn and apply that and then observe and then modify and tweak it so you can keep fine-tuning it and optimizing it each day. This is a daily practice.
Yeah. So number one, micro breaks, right? Number two was essentially, I think what you said was unplug and let's kind of and get an idea of what's going on with yourself, right? I think that's really accurate. We're spending so much time taking in so much external data in that we don't pay any attention to what's going on within us, right? So turn off the outside, pay attention to what's going on the inside is number two. And number three was, I think you said journal. So you're kind of writing stuff down and then have gratitude and forgiveness, right? I think it's one of those things. And I'll add to that thing, the thing I hear the most from people is that what stresses them the most is they're always have something to do and they never get done. Listen, done is for the dead. Done is the only people I know who are done are dead. Okay. So don't ever think that you need to be done. But I agree with Doni on that one. I like the idea. I call it an after action report. So at the beginning of the day, you kind of write out what you need to get accomplished. Keep those ideas in front of you so that you know that this is my hierarchy list and those are the things you stay focused on. And at the end of the day, the after action report. What did I do today? What did I get accomplished? What didn't I get accomplished? And I always look at it, if I got 50% of the stuff done that I set out for the day, guess what? That was a successful day, right? And so what didn't I get done? Give yourself, hey, maybe that wasn't as important as I thought it was. Do I really need to do that? Should that really be taking up mine? If it's, then you can reassess it. You know what? I didn't need to do that anyway. Get that off my list. Or, you know what? I didn't get it done. Why do I think I didn't get it done? But let me put it on my list to get it done tomorrow. So I love all three of those options. Now, let's finish with, where can people find more about Dr. Doni? Where can they get the books? Where can they hear more about you and what you do?
Well, my website is drdoni.com. Doni is D-O-N-I. It's short for Donielle. So just go to doctordoni.com, and you'll also find a interview where I interviewed Eric in my podcast, How Humans Heal. And then also there's blogs and so many resources because again, like I said at the beginning, I keep thinking about this and wanting to just share this information with anyone who's looking for this to help them. And then on social media, usually it's Dr. Doni Wilson, DRDONIWILSON.
Okay. Well, I got it in. I'll put that stuff in. I think you sent me all those links, so I'll put those in the notes. And I think you did a fantastic job. I think this is worth for people to listen to a couple times. But I appreciate you coming on the podcast again, and we'll do this sooner than 6 years and have another session. But I appreciate you coming on, and I truly think we got a lot of good information to get out to our public. So,
oh my gosh, it's great getting to talk with you, Eric. It's so fun for me because, just thinking about this all the time and getting to talk to someone else who thinks about this all the time, and finding different ways to explain it. So I really hope that was helpful for our listeners.
Yeah. So for everybody listening, share this podcast with your friends and family. Also, go to wherever you download your podcasts and make sure